Hello, friends. I haven't been in here for a while. I'm Abby, to precepting, nursing, and also nurse practitioners. I just wanted to ask a question. I see a lot of people, nurses, whether experienced nurses, new nurses, on here and other places as well, encouraging, or discouraging newer nurses from working at bedside. Now, I totally understand how hospitals and other health facilities can treat nurses. Sometimes it's not fair, and there's so many things there that's wrong with the situation, with everything that goes on and all that. I'm totally aware of it. I'm not sitting here trying to say, but this one is wrong, this one is right. I understand that. But if we continue to discourage people from working, nurses from working bedside, who's going to take care of the patients who go to the hospital? I'm just trying to find where the happy medium is. How do we work with the hospital system and the nursing staff to be able to have enough nurses at the bedside? I like to call it acute care nursing because people hear bedside nursing and it has like a negative connotation to it. So who will take care of the residents? Not residents, well, residents if you're in a facility, in a SNF, but in a hospital, because your family member or friends, loved one will come to the hospital for one reason or the other. There will always be a reason to go to the hospital. Childbirth, surgery, sick, anything that requires you being in the hospital. And I know working in the hospital is backbreaking. It's mind-numbing. Sometimes you don't feel fulfilled because you have all these complaints and you don't feel your employer is listening. And I understand that. I just need to know what the solution is. That there would be enough nurses at the bedside to provide adequate care. Now, before anybody asks, I've already done my 22 years. So I was there long enough, and I'm not expecting anybody to stay there long enough. There were times where people stay at one employer or go move around and was doing bedside nursing for the entire career, or 10 to 20 years or so. And that's not the case anymore. I'm not convincing anybody or telling anybody you have to stay there and you have to do that. You have to do what's best for you and your family regardless. Okay, so you don't have to take what I said in this video and say, oh my God, what is she trying to say? I'm just trying to find, because, one of your family, or my family, me or you, will be in a hospital at one time in our lives. And we will be expecting that we have enough staff to take care of the people. So how do we reconcile with the hospital system and then nursing staff so that we have enough people at the bedside, and also people there long enough to precept newer nurses? I precepted like dozens of nurses in my time, and it's hard work too when you're precepting, because you're still getting the amount of patients and all. So I just need to hear your thoughts, because it's a safety issue. And it may be, I'm looking at the patients and just the patients, but that patient in that bed could be me, you, or somebody you love. I look forward to reading your comments. Please be respectful, and please keep it professional. Or just scroll. Thank you.